Well, if you've ever suffered from migraines, you know they can cause a lot of pain, sometimes lasting for hours. It can make it hard to work and really make it hard to enjoy life.
In the U.S. alone, almost 40 million people, that's including kids, suffer from migraines. So if you're one of them and looking for relief, listen up.
Yeah, we're getting some insight today from Dr. Jason Slagel from Spinal Balance Health Center. Doctor, good to see you again.
Hey,
Hello,
good to be here.
welcome
Thanks for
back.
coming in. So listen to this, there's different symptoms for migraines. What are some of the most common ones that you hear, what you see?
Right. So migraines typically are a more throbbing head pain. They can be sharp and shooting, and what we look at in our office is trying to find the root cause of it to help people. Because we find a lot of people come into our office and they've tried a lot of different things, right? They're on different medications that sometimes work and sometimes don't. They've tried diet and they've tried all these different things, and people are starting to give up hope. And so in our office, what we look for is the root cause to give back that hope.
So you do the research, you do the studying. How long have you been actually studying migraines?
So migraines have been studied for a long time. For me personally, I have a couple of research papers that we're working on right now. So we're in the process of publishing different things, just trying to get the word out and let people know that with our results, there's hope again for people who are starting to give up or feeling discouraged.
And there are some different treatment options out there, but there's something called, I think it was brain stem correction.
Yep, so brain stem pressure is what we look at in our office. So brain stem pressure is basically if the head and the neck get shifted out of place, then that can put pressure on the brain stem. And the brain stem controls a lot of different automatic functions in the body. So if somebody has a shift of the head and neck out of place and it's putting pressure on the brain stem, many times that can turn into migraines.
Now that shift, how do they happen? How does it get to that?
Good. So I'll answer that question with a question.
Okay.
What is the first potential major trauma that we all can experience?
Well, birth.
Birth, good. So many times if there's a shift of the head and neck at birth, just from the birth trauma or potentially a doctor pulling on the head or something like that, then somebody can have this shift of the head and neck potentially for decades.
So that can happen
wreak havoc.
just from birth, being born. You can have this trauma at the beginning, and it can impact you your whole life until it's then corrected again?
Exactly. So other ways that this shift can happen besides birth for people who dodge that is a very common one is car crashes. So really anything with a whiplash type injury, because whiplash is damage to ligaments, and the ligaments are what holds this together. So if you damage the ligaments and the head and the neck shift out of place, that's what it can put pressure on the brainstem. So car crashes, contact sports is another big one. So football, wrestling, and then getting hit in the head, bad falls, those types of things.
You just think about how active kids are as you're growing up, and all not only the sports that you're involved with, but just playing out on the playground. It could be something simple.
Yep.
How young can migraines start? What age?
So typically they don't normally start before puberty.
Okay.
Another thing the brainstem controls is hormone regulation, right? So once puberty hits and hormones start becoming dysregulated, that can also play into migraines as well.
Okay, somebody that's been suffering from migraines, a lot of times, like you've said, they've tried many different options. They come into your office for a consultation. What's that process like?
Great. So we sit down with them, and I want to know what they're experiencing first, right? I want to know what they're feeling, how it's going with them, what they've tried, what their values are, what their goals are, what they expect from me. So we go through all of that when we sit down and talk. After that, then we'll go through a full structural exam. Okay, so the brainstem controls automatic functions in the body, including muscle tone. So if you put pressure on one side of the brainstem, then it can cause one side of the body to squeeze down. So we look for a certain posture pattern that indicates brainstem pressure. And
we're looking at that right here. These are some of the techniques that you're using to test this. Dr. Drew obviously works in your office as well, so you do the same techniques.
Yep. So what he's measuring here is the posture pattern that happens when somebody has brainstem pressure. So then if we find that you have that posture pattern, that you have brainstem pressure, and we think that that is contributing to the migraines, then what we do is we take x-rays of this area up here to measure that shift so that we can calculate how to fix it.
Yeah, you talk about these research projects, and I want to touch on this really quickly, but can you dive into that a little bit deeper and what you have going on with that?
Yeah, so brainstem pressure can cause a lot of different secondary issues, right? So we've talked about migraines. Some of the other conditions that we're currently researching are scoliosis. So we've seen improvements in scoliosis curves anywhere from 2 to 10 degrees, which is pretty significant. It makes a big difference in people's lives. Another research project that we're working on is on hot flashes. So we've kind of touched on hormone regulation. This one lady came in and she was having 10 hot flashes a day. The poor thing, right? And then after she had been under care for a few weeks, her hot flashes completely went away because her hormones started regulating. So that was another cool one. Another one that we're looking at is rheumatoid arthritis. Okay, so we've seen improvements in rheumatoid arthritis pain, anywhere from 60% improvement up to 90% improvement in the pain.
So a lot of great research projects going on there. Well, if you're interested in checking out Spinal Balance Health Center, you brought a great offer for our viewers today. The first 10 people who call Dr. Slagel's office will receive a consultation, X-rays, and exam for only $50. That's a great deal.
A tremendous value. Yeah. And good information. SpinalBalanceHC.com is a website you can visit as well. Doctor, thanks for coming in this morning.
Thank you so much.
Thanks for having me.
Yes, we'll see you soon.